Okay, thank you, Shakira. I suppose this is 2 o'clock in the afternoon or the Malaysian time. First and foremost, I would like to welcome everyone from all the international participants as well as Malaysian participant. I can see that we have numbers of people from Indonesia, Philippines, Italy, Europeans, and from the Asian continents. So welcome to our complimentary webinar in conjunction for our ACOH, incoming ACOH for this August in Kuching, Malaysia. So having said that, I think without further ado, I would like to invite all of you to join today's webinar titled on sickness, absenteeism, and overview of causes and management. So this is our 19th series of online webinar that we want to share our expertise to all the potential delegates for our ACOH and to invite everyone as well to come for our ACOH in this incoming August. So having said that, perhaps I would like to share a bit, perhaps I would like to talk about some webinar house rules for those who actually for the first time that join our webinar. Please keep your microphone muted because we want to prevent any interruptions from other participants. Please remain focused during the session. Please use the chat box to ask the question. I will address your question from the chat box. Stay professional and respectful at all times. Please do not sharing any confidential information. And this session will be recorded and we will upload it in the YouTube later, and the link will be available in our website. And for those Malaysian participant, this session that you can entitle for these MMA CPD points that you can claim later for the continuous medical education purposes. Okay, thank you, you guys, for your cooperation. So we are going to conduct the session within an hour. So I am Dr. Fikri. I'm a public health medicine specialist majoring in occupational health. I'm currently working as head of OSH unit for the hospitals in Ministry of Health Malaysia, and I'm in charge of the OSH unit for all 150 hospitals. So for our speakers, Dr. Lim Jac Fang is known with his vast experience. He's an industrial hygienist, CPIH, registered consultant, OSHCR UK, occupational health doctors, freelance consultant, and trainers. So Dr. Lim Jac Fang, if you know about him, he's based in Sabah. So Malaysia is quite so-called big. We have the west part, the east part. So Sabah is at the eastmost of the Malaysia, which is next to Sarawak, next to Kuching. So our ACOH will be in Sarawak. Don't go to Sabah, but go to Sarawak, where Kuching is in Sarawak. And then we'll proceed next with the Q&A session. I will address your question in the chat box. And perhaps I will share some points about ACOH that perhaps some updates that all delegates may need the updated information on our incoming conference in this incoming August. Okay. So a little bit about the presentation today. So Dr. Lim is going to talk about the sickness absenteeism and overview of causes and management. So he would delve deeper in the key causes, patterns, and organizational impact, and looking at what are the occupational health factors and workplace factors, including all the risks, psychosocial influences, and work organization, and how to manage the absenteeism at the workplace. I believe this quite important, especially those hospital directors that joining us for today's session. Some supportive policies and leadership, roles of the management, and role of occupational health professionals. So this is important, having an input from the medical perspective as well in managing the organization. And last but not least is about data-driven strategies, where everything now is an evidence-based and it is strongly driven by a good data set in order for us to reduce the absenteeism and improve the well-being and productivity of the organizations. So I think, and as I've mentioned earlier on, Dr. Lim Jac Fang is the industrial hygienist. He's a senior occupational safety and health professional specializing in industrial hygiene, chemical risk management, and OSH governance, providing expert advisory, training, and leadership to support compliance and sustainable workplace health. Okay, so I think without further ado, I would like to welcome Dr. Lim Jac Fang to present and to deliver his talk. And I am actually excited to know more about this sickness absenteeism. As we are working in this big organization, we wanted to know more of how to ensure our organizations remain productive. So I hope all the participants can join this segment, and feel free to ask in the chat box for any of your burning question. We will try to address as much as possible. Okay, without further ado, please welcome Dr. Lim. The floor is yours. Thank you.
Okay, thank you, Dr. Fikri. So it's selamat petang, selamat sejahtera, and a very good afternoon post lunch. Very challenging period. So I'll try to share based mostly on my own experience over the years. And actually, why I started with this, I first presented this topic in a conference way back in probably 2005, one of our conference on occupational safety health, which is the premier event in Malaysia at that time and still ongoing. And at that time, I thought as a doctor, even before I took up occupational health and even delve into occupational health safety, industrial hygiene, and so on, I started off as a medical officer. Even at that point in time, I used to face a lot of these sick leave and medical requests for absenteeism, even though we all know very well most of the cases not involving medical related. So as I transitioned into the health and safety field, which was, I started in 1990 and I started my occupational health practice in 1999. So I was lucky in that way because it's like a seamless start from being a medical officer and then transitioning into workplaces as an occupational health practitioner. So my presentation will be based on my experience and in the Malaysian context. And for international participants, you can refer to your local labor laws, regulations, and so on, which I will be talking a lot and showing you the Malaysian requirement, why doctors are pressured and bear the brunt of issuing MCs, even though we know very well they are not much related to medical related problems. So, and that also add on by the pressure probably from the HR side and the employers, okay? And then of course, finally is the challenge from a very, very well-informed workforce. What are their rights and privileges and so on. So with that, I will start my presentation. So I hope you can see the slide. So first is, we all know that it is a very difficult management problem in industry lah, because it disrupts work schedule and staff assignments. People suddenly not turning up, very, very challenging. Important cause of lost productivity, labor management conflicts and misunderstanding, and of course, finally, as I said earlier in the preamble, is poor doctor management relationship. So sometimes they will call us and then they will demand answers why this much leave is given. Actually, is the person really sick and so on and so forth. So before we dive further, we need to know what is absenteeism as a basic. So it's a habitual failure to appear, especially for work or other regular duty, and the rate of occurrence of habitual absence from work or duty. So that's absenteeism in general. Where sickness absenteeism is non-attendance at work by an employee due to or related to an illness and or injury and is acceptance by the employer. Implies that a worker is absent from work due to a medical reason. So that means it's a doctor's opinion. So because of this, people tend to look at doctors as the main cause for high rates of absenteeism. That means we dish out sick leave as in medical related or non-medical related due to reasons, which if you are a medic, you would understand that sometimes you are pressured. Even I have patients yelling and banging on the desk and so on and so forth and demanding. So in that context, we need to understand why what do you call that, doctors bear the brunt. So before that, we need to look at 6 basic categories of absenteeism lah. The first one is the sickness absence, is defined as absence attributed to incapacity due to illness or injury that is not work related. So that is in general. The second one is personal leave, which is defined as absence for personal reasons having nothing directly to do with incapacity. So that is another group of people that will come to you. And why they come to you later, we will see there is a reason for that, why they come to doctors. The other one is time loss or the occupational injuries or illnesses. These are reportable under workers' compensation and relevant laws and are therefore closely monitored. Then the fourth one is the pregnancy and childcare leave. This is planned and pre-authorized under existing laws and employers' policy. And the fifth one is partial absence. That means they come for part a day, half day, or they come with a medical explanation for their absence. And the sixth one I added myself, which I'm sure most of you know, is presenteeism. Presenteeism means being in the work but not being functional. So whether they should fall under this category or not, I leave it to your individual opinions and experience. So sometimes presenteeism is better to be absent fully than to be present. So sickness absence can be further categorized as one, certified by the doctor, which is the most common. Uncertified or self-certified, this is not practiced in this country. And I think we should be very cautious about practicing this because otherwise everyone seems to be sick all the time, all right? And then, of course, the third one is by prior authorization, that is doctor's appointment for an ongoing problem, follow-up, and so on. So now to get a better context as to why doctors are pressured actually is because of the understanding through the Employment Act 55 or the EA 55, which stipulates the minimum conditions for employment applies to all people in Malaysia. At that point in time, when I first prepared this slide and I made the modification recently, is the bracket. Last time was the pay of 1.5K, but now it includes up to 4K. So under this Employment Act, female employers are not permitted to work in any industrial or agriculture undertaking between the hours of 10 p.m. and 5 a.m. except with the prior written approval from the Director General, all right, of the Labour Department. And female employees are entitled to 60 then, but now it has been made better or improved to 98 days. That is the improvement, the latest amendment of paid maternity leave up to 5 surviving children. So why I'm going to all these things is because once they exhaust this avenue, the only way that they can legitimately get a leave is the medical cheat, all right? So again, you have to understand the normal hours of work shall not exceed 8 hours in one day or 48, which is now reduced to 45 with the latest amendment in 1 week, and they should have at least 10 gazetted public holidays in any one calendar year. And so on, the replacement leave and so on and so forth will be updated regularly. Then comes the other aspect of their leave or absence, which is paid. So you have the annual leave. Employers less than 2 years, not less than 8 days per year. So if they exhaust that and they are not sick, so they have to become sick. Otherwise, they'll be penalized. So if you're employed between 2 to 5 years, it's not less than 12 days per year. Employed for more than 5 years, not less than 16 days per year. And mind you, all this leave usually is written into their policy is the prerogative of the employer, meaning to say, even though this is due to you, your right, but the employer must approve your leave. So in this case, if the employer don't approve your leave, so what is the other alternative? So you know the answer. So then comes the sick leave, which is a section 1660F of the Employment Act. So if you're employed less than 2 years, you do not get, you get not less than 14 days per year. Employed between 2 to 5 years, not less than 18 days per year, and employed for more than 5 years, not less than 22 days per year. So if hospitalization is required, then sick leave of up to 60 days shall be allowed. if an employee is sick during annual leave, he or she is eligible for an additional day of annual leave. So again, you can see why I'm putting up this sort of information or data so that you can best understand why and what motivates workers to go on leave, right? Or pressure the medical side. I'm talking purely from the medical side of view. So what is the medical practitioner's role in sickness absenteeism? So under the Employment Act, an employee is entitled to paid sick leave only after examination at the expense of the employer by a registered medical practitioner duly appointed by employer. So that means this employee cannot just go anywhere. He has to go to those panel doctors or those that are employed. But if there are some circumstances, there is no such medical practitioner within his area or out of station, then he or she can attend to any registered medical practitioner. Then another section says an employee who absents himself on sick leave, A, which is not certified by a registered medical practitioner or a medical officer as provided in 1, or B, which is certified by such registered medical practitioner but without informing or attempting to inform his employer of such sick leave within 48 hours of commencement, shall be deemed to be absent himself from work without the permission of his employer and without reasonable excuse for the days on which he is absent from work. So that again will force the worker, whether he's on leave or not, or otherwise, he has to take the sick leave. So what is the causes of absenteeism? You can see here is listed down a whole host of causes from serious accident illness, which is the usual one in the workplace, which no one is going to query much. The other one, of course, is very organizational, like low moral, poor working conditions, boredom, job satisfaction, leadership, etc., etc. And of course, the latest one, on your right side, you can see I highlighted stress. Stress is the thing that is in. So stress here can mean both. It can mean stress at organizational level and also stress at personal level and other areas. Usually there are only two major, the personal and the personal side and the organizational side. So just looking at organizational is not enough to solve the problem. You need also to settle the personal side. Otherwise, it will definitely affect work or his presence. So a study on postal workers in UK by Taylor and Pocock has this divided into three main areas of what why this leave or absenteeism is taking place. It could be due to geographical. You can see the example there, organizational, or it can even be personal. So that means we need to look into all three when you are actually determining the acceptance of the leave. Okay. So what is the cost if somebody keeps on disappearing or absenteeism? So the first one, of course, is decrease in productivity. So employees may be carrying an extra workload or supporting new or replacement staff. Employees may be required to train and orientate new or replacement workers, and staff morale and employees service may suffer because somebody is always sick, somebody is always not there. So it definitely can affect. So the second one would be financial costs. Payment of overtime may result. Cost of self-insured income protection plan must be borne plus the wage cost of replacement employees. And then probably in certain industries, premium costs may rise for insured plans. The third effect may be the administrative costs. That is, the staff time is required to secure replacement employees or to reassign the remaining employees. And then the staff time is required to maintain and control absenteeism. So overall, if you don't really manage you don't have a good absence management in general, actually, it can become a vicious cycle of why one of the main drivers why staff leave or seem to not want to be present at the work. So monitoring trends in sickness absenteeism, you can use the lost time percentage or you can use any other rates that you are comfortable with in your company. So one of these is the lost time percentage, number of working days lost due to absence, total number of working days for all workers in 1 year by multiplied by 100. So you can get that. So what's the use of this? as a means to compare with other organizations or within organizations. You can track your activities and whether your interventions are working, identifying work sites with high rate and contributing group of workers. Who are these people and what you need to do, and then for review and improvement of performance, as well as identify any undiagnosed medical condition that could contribute to high sickness absence. The worker may not even know that he or she is suffering a problem, or maybe underdiagnosed, misdiagnosed, or overdiagnosed. Then to identify contributing factors at work, to identify non-occupational factors that can be corrected by appropriate follow-up and counseling, and of course, as a way to express management concern. So what are the trends in absenteeism? The higher the rate of pay and the greater the length of service of the employee, the fewer the absences. So that's why now people talk about Gen Z and baby boomers and so on and so forth. You can the divergent views on what is actual work and why you should be working or absent is very, very different nowadays. The second one is as organization grows, there's a tendency towards higher rates of absenteeism because probably newer workers are coming in. And then women are absent more frequently than men. Single employees are absent more frequently than married employees. Younger employees are absent more frequently than older employees, but the latter absent for longer periods of time. Unionized organizations have higher absenteeism rates than non-union organizations. So in Malaysia, we are a bit lucky or otherwise that we don't have much of union. Smokers are absent more frequently than non-smokers. So these are some of the findings from the studies, research, and so on. So how do you know, or how do you want to manage this sickness absenteeism after having understood GAN? So it's not for me, I think it's more of the what you call a round table kind of thing. We need to sit together. So as far as I'm concerned, what I have noticed is between industry and the doctors and the HR, I think we don't see eye to eye, and you don't even attempt to sit to see eye to eye. So that's a kind of probably defensive, confrontational kind of thing. Whereas if you are managing in your own organization, probably you can manage it better. Like for example, I'm in the healthcare, so I'm the management. When I reach management level in healthcare, I can call in the HR, call in the doctors, call in the workers, and you can have a discussion and roundtable and so on. But what if you are in the private sector and you are a general practitioner or a government doctor and you are dealing with a company's problem? So that's what I see. It's time to get out of the silo and actually work together. So there are 4 key areas to look at. You can modify this accordingly. If you are a HR, you modify the HR role and so on and so forth. But I'm talking in terms of a medic. So that's why I emphasize the medic part. So the first 4 key areas is the organizational level. Look at your policies, your management systems, and how you promote staff, pay, training, and so on and so forth. So organizational stresses, I think you need to level it out first before what they call going further. Because well, the old cliche saying is a happy worker is a good worker and so on and so forth. So how to keep that person happy? So the second one is the individual level. What is in the individual and how and what is their need wants, and does it align with the company's what they call vision, mission, and so on. And then of course the general work environment. And of course the fourth one is the doctor's role in managing sickness absenteeism, and that's where I said if you are HR, you can modify that. If you are employer, management, CEO, you can also modify that. So I will only focus on the doctor's role. So as I said earlier, this is a medic thing. So doctor's role in managing sickness absenteeism. So basically, what is the doctor's role in the work site or workplace? Number one is promote and maintain the highest degree of physical, mental, social well-being of workers in all occupations. So the prevention among workers of adverse effect on health caused by their working conditions, protection of workers in their employment from risks resulting from factors adverse to health, placing and maintenance of workers in an occupational environment adapted to physical mental needs, and the adaptation of work to humans. So basically, the occupational health services that you would provide or the doctors is basically maintaining the health of the workforce. So occupational health and safety encompass the three from the word health. That is the social, mental, and physical well-being of the workers. That is the whole person. So basically, are we doing what we are supposed to be doing? Because it seems to be like sometimes in piecemeal. Right now, the hot topic of the day is psychological, mental health, and so on. But actually, from my perspective, it has been there all the while. It's just that probably it wasn't a priority at any point in time until suddenly it became such a big issue. Especially during COVID when it came up very strongly, and now you have guidelines and so on and so forth. But whatever the guidelines, in my opinion, I think at the end of the day, we need to look at that for intervention, which I've discussed earlier. That is organizational level, individual, environment, and also what are the things that you are doing to actually keep the worker productive and do quality work. So the doctor's role in managing sickness absenteeism, uh, first is to examine and confirm that the worker is ill, unwell, and needs to be absent. That is important. Then analyze the likely pattern of absence associated with that disease. Assess whether the worker's previous pattern of sickness absence is likely to be recurrent. For workers with confirmed medical problem, monitor for greater than normal absence than would be expected. Probably be prepared for a medical review or medical board out and so on and so forth. So here is like a very silo thing because like this is what the doctor does and this is what I'm discussing at the role of the doctor. But then if this information doesn't go to the employer, HR and other personnel involved in reviewing this worker, then I think it's going to be very, very siloed, very difficult paper pushing kind of thing. So it's not going to work. So I think we need to form a sort of a small committee individually for certain cases, not all cases. And then, of course, to identify non-occupational causes, could it be domestic, personal, etc., and also to provide an opinion whether there are work-related causes leading to this, and preserve the doctor-patient confidentiality by presenting the report in simple terms, that is non-medical terminology, to the management. That's where we need to sit together. So in my personal experience, even though I was in service all the while, but I do deal with especially the small medium industries, it's quite difficult to get time to even discuss. And small medium industries, their issue is they don't have a real sort of a department of human resource or to deal with it. Usually it's one-man show kind of manager, supervisor, and all the designation, and he or she is supposed to deal with everything. So that is another difficulty that I used to face earlier. Then to attend health and safety meetings of the company, which is almost non-existent. I don't know what's your own experience, but that few and far in between that I am invited to attend, that is a good move by the company. But then again, whether it's sustainable and maintained for the long term, that is another challenge. And then, of course, to play an active part in the company's health and safety programs like their health promotion, etc. So again here, how many companies are actually doing health education, promotion in the workplace and so on? And what is the role of actually the occupational health practitioners in this? So sometimes sometimes in cost saving measures, you don't want to invite outside people thinking that you might need to pay them and so on and so forth. So everything is like very in-house. So as to whether it is an effective thing or not, I'm not here to say that. But again, depends on the individual running. Usually the safety department or safety officer or in Malaysia, the smaller companies, they have the what is known as the occupational safety health coordinators lah. So having said all those things, always remember doctors are not management policemen. So we need not be there to fight. We just be there to emphasize on fitness to work, whether that person is healthy, ill. If not, what kind of discussion can be can be done for job modification, uh, probably accommodation, and so on, so that the worker can, in whatever individual case, can continue to work and continue to contribute to the worker. So basically to maintain the well-being of the worker. All right. So basically, sometimes you get this kind of statement where uh, the doctor says you're not well, so you can't do this work. And because you can't do this work, so you're not fit for our workplace anymore. So it's sort of like an excuse to terminate based on a doctor's recommendation, which is not true actually. So that's why doctors who write medical report, fitness report, etc., should carefully word it and make sure that it is being discussed before your kind of report is used. Oh, the doctor says you're not well, so you can't work anymore. Oh, you are this and that. So I think we should try to avoid that. So that's why I emphasize in red, you are not management policemen, we are not the gatekeeper and things like that. All right. So don't fall into that mode. So how to take affirmative action to control absenteeism in such a way as not to create mistrust, costly administration, and system avoidance. That means the game players lah. So again here, I think we need to tread carefully. We need to be having good policies. We need to have a good team to discuss so as to not to entangle ourselves legally or so, because now legal issues are actually becoming the norm. So again, we need to look at how we operate our workplaces. So one of the answers to this will be to implement what is known as an attendance management program. So to understand this absenteeism control, when I say control here means we are not denying anybody anything. We're trying to sort of mitigate, reduce the problem. So sometimes the word control can be very, very controlling. So there are two types of absenteeism, each of which require a different type of approach. So you have one is innocent absenteeism, which is actually illness or injury related. So employee is not at fault. So this one is quite straightforward. But what is not straightforward is sometimes you get a call from the management side. Why you give 3 days? Why you give 2 days? Why 1 month? Things like that. So I think both sides need to be clear what and why sick leave is given. So even doctors need to know the what they call the leave that you give is based upon, of course, your professional opinion, but actually based on a very sound judgment. Now, for example, is it fair to give a person who just give you one real life example? This women worker, she had a sort of probably miscarriage or something, and then she had a DNC. A DNC means dilatation and curettage. You clear up the womb lah. Very early pregnancy, and then she was given like 3 months of sick leave for such a, I would say bracket, simple procedure lah. So some who are not knowing will say, oh, it's a big deal. But medically, do you think a straightforward DNC requires 3 months? So again, we as medical practitioners, I'm talking from the medical practitioner side, should actually be cautious and give a fair leave. And why do you give leave? Because you want the patient to rest and recover so that he can go back to work safely. So that is the actually aim. So it's not to like go on a paid holiday kind of thing. Okay. The second one is culpable absenteeism. That is unexcused absences, lateness, abuse of the sick leave, and so on. So this is where we also have a problem. So not to say that your innocent absenteeism is free of worries or straightforward. Doctor gives the sick leave, prerogative of employer to accept, so accepted, and it's the right of the worker and so on. So fine, but actually. Again, I give you an example, kan? So even innocent absenteeism can create a friction and misunderstanding and mistrust. So by culpable absenteeism, I think it's a bit more straightforward than the first one. So how do you deal with repeated short-term absence for employers? So from the employer side, you can counsel the employee, investigate the cause. Of course, when you investigate, you have to take in all the opinions, probably need meet eye to eye with the relevant professionals. You can discuss with the supervisor, is it affecting your work and so on, and discuss with the doctor. Probably need some job reassignment for that period, or probably you find that there are mitigating some points there. You can caution the employee. And of course, finally, if you have proof that there is an issue, then you can take disciplinary action. And then, of course, you can review the case, of course, within a certain time limit, and finally dismissal. And that is the most extreme step to take. But at the same time, at the end of the day, whatever steps are being taken, employers must make sure that they follow the labor requirements, like for example, what they call that, disciplinary action procedures, and so on and so forth, to avoid complications later on. Okay. So for the doctor's part, actually is what we have seen earlier. You have to examine, analyze, make sure, confirm the problem, and so on. And then, of course, the report will be sent to the employer. And then best will be everyone sit together and discuss the issue at hand. All right. So key expertise to engage in assisting employers' decision making, as I said earlier, must be eyeball to eyeball. Our roundtable is the human resources to ensure fair procedures and consistency with employment practices lah. So I've attended actually previously due to my own interest, what they call industrial court cases, and I wouldn't say there are any winner or losers, but mostly what I see is a failure to have a strong policy in place for this kind of situation or different situation, is where you leave yourself open to what they call, I wouldn't say losing, but losses. Okay. And then for the occupational health side, to assess fitness for work, explore adjustment, and evaluate future attendance prospects. So again, that's where you need this expertise. And third one, of course, we need legal expertise to address complex legal considerations, because you must know the HR or doctors, they're not really into the legal thing unless they are always involved, read on their own, or attend some courses or programs to update their expertise. So these three are the key expertise. So in your decision making for managing absenteeism. So then why is it continuing to happen and happen again? So these are the challenges. So the first one is employers being unaware of their legal and procedural duties. I mean, I'm not so much involved now, but then when I was active, probably more than a decade ago, this is what I noticed from even my own internal training in safety. When I do ask them about their rights, so most of them answer very differently. So for me, I gather that some employers actually don't really inform their employees, and some employees assume based on hearsay or from my friends, kawan-kawan, and so on, said like this, said like that. So this is the challenge. The second one is unresolved work-related obstacles, unaddressed performance concern. So, for example, a worker came in, he's given, say, 6-month probation, even though the word actually don't exist, and then to be reviewed for confirmation after that, and then suddenly you're just extended. There's no letter of confirmation. So that becomes an organizational unhappiness. So the person might think, is he going to work here or not, or is he getting the privilege or what, and that sometimes will push that person to get sick sick leaves, so they be absent for whatever the reason. All right. And then insufficient exploration and implementation of reasonable accommodations, especially the chronic, what do you call that, disease patients. So sometimes no accommodations are made for them. So they try to be on leave and or whatever means not to be present at the workplace. Then, or employees not knowing their rights and available support, like I said earlier, which I touch on, and treating health practitioners unaware of possible workplace adjustment or the risk of dismissal. So sometimes when you keep on giving sick leave, and then once you exceed it and both parties are not aware of it, so that worker become liable for the next medical review or medical board out or industrial action, disciplinary action. So everyone should be aware of what is actually happening in the workplace. So especially if you're a health practitioner. Okay, and then for the employers, make sure your workers are updated on their, you cannot just say, okay, giving them a contract and they, sign and they all know already. But how many of us actually sign any contract and read it, for that matter? Even simple S&P of purchasing a house, you don't even read it. You just say that, oh, it's standard, it's a standard, so it's standard. So we just accept it. And of course, sometimes we can say, who is going to read pages and pages of document and in jargon that nobody understands. So this is a challenge. So in conclusion, attendance improvement programs can work if only you are patient enough, meticulous enough to apply it. And what the employees require is commitment and support from all levels of management. And effective attendance record keeping system that is, I think in this modern day and time, I think most have. But I would say that small, medium industries, again, this is a huge challenge. And then the smaller, what they call it mom and pop industry. That means those industry that is came up on their own, not as a conglomerate. So they have a different way of doing things. And then make sure the consultation and open communication on the reasons for this program that you are implementing or any new policy and so on, to avoid any misunderstandings and unhappiness in the workplace. Okay, but you cannot keep everybody happy. It's not our job also, but we can keep them reasonably motivated at work. So that should be our aim. So as Dr. Fiki said, that was actually my end of my presentation. I hope I'm on time, and do attend ACOH, Asian Congress on Occupational Health, happening in Borneo, in Kuching. So you can register your interest if you still got time, and if you have papers to present, please do. I don't know whether it's still open or not, but you can get in touch with the organizing committee. Yeah. And thank you very much for your patience and your time. And see you all at ACOH 2026, Kuching, Sarawak in Malaysia. Signing off. So back to you,
Thank you.
Fikri.
Thank you, Dr. Lim, for quite an insightful presentation. So I suppose we go to the next session. It's about question and answer session. So Dr. Lim, we have quite a number of questions that wanted further explanation from your side, based on your experience and your expertise. And first and foremost, a question from Professor Dr. Abu Hassan from Malaysia. He's asking about some trend or some situational analysis of whether is sickness absenteeism now is a real concern to Malaysia, and if it is, how big is the issues in public as well as private sectors? So this is the first question. Perhaps you want to address this first, Dr. Lim?
Yeah, I think I'll answer one by one. As I said earlier, my interest was in the early part of the decade lah. So at that point in time, when I was a manager, that means a medical health officer of a district, as well as the head of the occupational unit in the state health department, I feel it's the way you manage the problem and how you manage your workers that can actually drastically reduce the sick leave or absenteeism in general. But when workers are unhappy with you or the management organization, in the Malaysian context, we are not going to voice it out. We are going to just react and find ways to not be present. Or in sometimes that's why I put as presentism. Presentism means being there but not there. So it's as good as being absent. So Malay, they call it curi tulang and curi whatever lah kan. So yes, it is still an ongoing problem. I do hear empirically from my general practitioners, friends, they still face the same problem. They still, I think it's ongoing. I think we need to address it probably at the national level. And we don't see much touch on this topic, probably on the HR side, but definitely in Ministry of Health. When I was there for almost 30 years, I think this issue is like endemic, I would say, endemic. You want me to show you data? As I said, this is what I practiced a decade ago. I'm not being really in touch with it, but I thought this topic would be interesting for sharing to the next generation of practitioners.
Yes,
Okay, I
thank
hope I
you.
answered
Thank
that.
you.
Yeah.
Yeah, thank you, Dr. Lim. Perhaps Prof. Abu Hassan, I would like to share some review of a workplace well-being and employee performance of public sectors in Malaysia. The data was published in International Journal for Research and Innovation and Social Sciences, and roughly from that 2024 study conducted by University Technology Mara, it shows that the public sector actually hovers around 4.2% of sick absenteeism, while the private sector at lower rates around 3.5%. But overall, in terms of sickness absenteeism as well as presenteeism, roughly for total Malaysian workers is an average about 67 days a year, roughly 2 months in a year where we lost our productivity towards in terms of sickness and presenteeism. So more roughly sharing the data, Prof. Abu Hassan. Okay, perhaps second
Yeah.
question, Dr. Lim. This is quite interesting question, especially on the practitioner side, being a doctor. Prof. Abu asks, how do we address the perception of the management and the HR that the doctors always have this tendency or soft spot to issue medical leave to the workers? The perception from the management.
Yeah. Actually, doctors don't have a really soft spot on these things. They don't, especially personally myself. I would rather put it straightforward, tell it in your face, you don't deserve it and you don't need it. But based on my early experience, how I handled it was, as I said earlier, some people will come and bang on the table, kick the table and yell at you, and their family members will come after you and so on and so forth. But I think it's the integrity, your professionalism in managing the case. So in certain circumstances, yes, I'm also one of the contributors, because why? You're being threatened and Z person refused to move, and the early years we don't have security and things like that. So who's going to defend you? So you issue the leave under duress. But then when I think about it, my next move was to call up the company management. I call up the company's management. I said, I've given this leave under duress. This is confidential. And I leave it to you to, on your side, how would you want to manage this patient? Because I can make a police report and so on and so forth. But then again, as I said, let it be an individual reaction to each individual case lah. But in general, no, I do not give. I only give what is the when this issue became hot quite early on, we started issuing what is known as what do you call that? What is that paper that says you have been to the clinic, the prior
Time off.
appointment,
The time off
you
sleep,
visited.
sleep time off.
Yeah, the timeout slip. So we only issue timeout slip, take it or leave it. So from there, we of course evolve also. So that is how personally I would manage it. Just
Mm.
if they are deserving of sick leave, by all means, your professional opinion. But if they are not, you just give them a time slip. That's it.
Yeah,
Sorry,
thank you.
I forgot all this terminology because I don't practice the
Yes, thank
clinical
you,
part
Dr.
of
Lim.
it for
Quite,
many years.
yeah, I think it's quite interesting response on it, and perhaps
Yeah.
for from the perspective of the Malaysian practitioner,
Yes.
if it's a genuine case to issue the medical certificate, yes, we have no issues on that. However,
Yes.
if there is any potential fraudulence case or any foul play to be conducted among the doctors, we always being governed by the Malaysian Medical Council. And we
Yes.
also have an authority body within Ministry of Health that look into all the issues related to complaints if there is an issues regarding the misconduct of the doctors issuing unnecessary certificate and whatnot. So perhaps there is some mechanism to safety net and to prevent such situation if the issues being prolonged in that sense. The
Exactly.
third question, Dr. Lim, this is from Puan or Madam Ali from Malaysia. She wanted to know more about two factors that you mentioned earlier on based on your presentation. These are the two factors that prolong or causing more frequent sickness absenteeism. Number one is being single worker rather than married worker, and number
Mm.
two being a smokers are absent more than non-smokers. Perhaps Dr. Lim can elaborate further of why being single and
Yeah.
being a smoker absent more at workplace.
Yeah. Single means equal, free and easy. So they have no compulsion. They have no most. I won't say all. They tend to have an easier life. They sustain themselves, and also their responsibilities are much less. They are not answerable, say, to their families and so on and so forth. So for them to take a leave for whatever the reason, like a Friday night leave or Monday blue leave, is not a very difficult decision to make. So, but again, I'm not generalizing for everybody, but that is one of the reasons why single workers are, what do you call that, prone to taking sick leave. The second one is smokers. Smokers, as you know, in the long term, they cause bronchitis and lung issues and so on and so forth. That is one. The second one is that is the sickness itself happening. So they will tend to, especially in the early on when they are mildly having that problem. So they tend to just go to a doctor, see the doctor, and then of course, if the doctor diagnosed as bronchitis or, uh, need a break, certainly he will be given the leave. Then the other one is I do not know whether it's still happening, but I'm quite sure it will happen if smokers tend to be presentism lah. That means they tend to be addicted because it's a form of addiction, so they tend to leave their work very often lah. So that is one of the reasons why these two single and what do you call that smokers tend to be absent lah. All right. Okay.
Mm. Okay, thank you, Dr. Lim. I think it's quite clear in terms of
Yeah.
the further elaboration of these two factors.
Yeah.
The next question is about more technical, is regarding the PDPA. So, Madam from Priya, she's asking about these confidentiality issues to declare your sickness to your employer or your boss. Is that allowable under PDPA?
Not only under PDPA, is even under medical ethics, you're not to disclose the disease of the attending patient or worker to anyone without his or her prior consent. So that is the thing. So whether it's PDPA or otherwise, you're not to disclose. But if the worker is have got the permission from the employer to attend to any of the panel, then of course the details will be captured. When he went, what, how many days leave, and what's the charges, and so on and so forth. So there's nothing very secret about that. The only part of the PDPA and medical ethics is the disclosure of the diagnosis. So a lot of employers and HR, they sort of like early on, I'm sure now they are much more informed. Early on, they demand the diagnosis. They demand a diagnosis from the doctor, which is actually PDPA. You cannot, even medical ethics, you cannot disclose the disease of the worker. All right. So I hope it answers your question.
Okay,
Yeah,
thank you,
Fikri?
thank you.
Yeah.
Yeah, even if to add on to that, Dr. Lim question, however, within certain situation, if the diagnosis of that workers may pose additional risk to the workplace, so we have to move from PDPA to OSHA Act, whereby if there is a risk to endanger himself or to others, then further action is needed. Where if there is a need to disclose that, but perhaps that's from different perspective. Another one,
Yeah,
Dr.
that is,
Lim,
yeah.
from that's good. Yeah. Another one, Dr. Lim, is about the terms, what they call as return to work programs in terms of effectively managing the sickness absenteeism. So in your opinion, what are the roles of OH practitioners can play in developing and promoting return to work program for the employee with injury or illness at the workplace?
Well, return to work program is a very, very big program actually. When you want to send the process, you have to go through different levels. First, you have to get the diagnosis, the disability, and then once you assess them, then you see their level of fitness, and then after that, if they need rehabilitation, you need to form a team to settle that, which I think Percoso is doing a good job. You know, they have the rehabilitation thing in Malacca and all that, and accommodation, the involvement of the physiotherapists, occupational therapists, and so on. So return to work, yes, the occupational health practitioners has got a role to play, but it depends on how much you want to be how much you want to be involved. Because if you are a GP, I think you are quite limited in your involvement, except at the management, early management level and the examination level. But after that, if you have prior interest in it, probably you can follow up with the attending rehabilitation personnel or facility, or even the specialist, the rehabilitation specialist. So I think that is what I can say at this moment. Yeah, back to
Thank
you,
you.
Fikri.
Yep, thank you, Dr. Lim. But I think the question is keep coming in, but I try to reserve in view of our limited time. So I only got another two questions because these two questions are repeating among the participant. Number
I
one
see.
is about this: if the employee is being issued the sick leave and declared unfit for work by the doctor, can management still require the employee to attend for the some short meetings? So, and can the employer refuse to attend without facing any disciplinary consequences? What's your view, Dr. Lim?
Say, if I understood correctly, what you're asking is if the doctor issues a sick leave, am I right?
Yes, but the
Can the
management call for a meeting.
management call for a meeting? I think there's no straightforward answer, because number one, sick leave is the professional opinion from the doctor. Acceptance of the sick leave usually will be accepted by the employer, citing whatever the person need to rest and recuperate. Personally, at a personal level, it will depend on the worker. What is his condition and his perception and his commitment to the company lah. Huh? Whether he needs to attend the work or not. So basically, I think you're asking is, can he refuse not to attend? Am I right?
Yes.
That I cannot say for sure. Because why? As I already explained to you, sick leave is given based on a professional opinion that this worker needs to get his rest for recuperation and getting better. But at the same time, if it is a critical meeting at the management, and if it is just a meeting, for example, and I cannot define what the meeting is, and the employee feels he or she is able to contribute to the company, then it is up to the individual concerned whether he or she wants to attend that meeting. Because what you say theoretically and what is reality is, in my opinion, very different. Okay? If you're talking
Okay.
about the law, yes, sick leave should be honored by the employer.
Yeah, yeah. In the end,
Once
we
the
would like to follow on the company's policy, that we are
exactly,
clear to follow the doctors
yeah,
and respect the
exactly,
doctor's decision.
yeah,
Yep.
yeah.
Yep. Okay. And last question, perhaps, Dr. Lim, is about mental health. And it's quite interesting question. How can we legally treat mental health days with the same validity as physical illness without compromising compliance under the Employment Act?
Well, let me put it this way: mental health is such a broad minefield. Are you saying he's gila, or are you saying he's depressed, or are you meaning to say he's stressed? So it's very different. If you are talking about the normal, for example, mental health, that is stress at the workplace, then I think you need to mitigate. What are the, there are ways to mitigate it, and that is you need to have a action plan of how you want to deal with mental health issues at the workplace. If it is found to be related, work related, that means he's unhappy with his condition of work there, his pay or otherwise, then you need to mitigate that. That is organizational contribution of stress. But if you say he's gila and kemurongan and all, that's disease. Then you have to refer to the attending physician or doctor, and then the doctor needs to decide whether it is what kind of mental situation this worker is in, and then deal with it appropriately. But if I understand what this person is trying to ask, but mostly it will be related to stresses at the workplace. Okay,
Yeah.
and mostly it's organizational. It's
Yep.
unhappy with management usually.
Yep.
So if
Yep.
you don't deal with that, I think forever you'll be unhappy. So and continue to be unhappy. Well, like I would say, the door is there. You just open the door and just walk away. Find a place where you are happy with. Otherwise, you keep being unhappy there. You go to the next step, which is really mental already. All right. So I think we should avoid that. So, but again, how many workplaces will have EAP, employment assistance program? How many workplace will have this to be able to, for workers to, like an ombudsman, no, to third party kind of thing, to go and voice out before it reach that mental level. So basically, that is where I think we need to improve a lot, because I don't think many companies in Malaysia, certainly not in SMIs, certainly not in Ministry of Health, we have EAPs, as I understand. So basically, left to the management to deal with it as seen fit. So again, there's no easy answer to that. There are a lot of work to be done in this area. So I pass it back to you.
Thank you, Dr. Lim. I do
Yeah,
understand mental health a bit complex, the spectrum of
yeah,
disease coming from this end to another
yeah,
end. This complex situation requires more comprehensive system to deal with it rather than
exactly.
being treated similarly like any other physical illness.
Yep.
Thank you, Dr. Lim. I think that's all for the question and answer that we can cater based on our time limit. However, I would like to note down during this session, we are actually honored to have the Deputy Director from the CCAPS, the Private Facilities Authorities, that also acknowledge the concerns of any fraud being conducted by doctors. The complaints will go through the Ministry of Health, and this vote of confidence is actually trying to maintain our integrities and our way of work among doctors, and to issue the appropriate medical certificate for those workers who deserve. So with that, I would like to thank you, Dr. Faizal, from the Deputy Director from CCAPS, for joining us today. Okay, I think that's all for the question and answer for all of you. And the next slot is I would like to touch a bit about our promotional on ACO. It's going to be conducted in 6 to 8 August. So we would really love to see all our participants here, especially from the Philippines, which is very close nearby to our Malaysia, to come and join us. We would like to know more about how's your best practice there, and perhaps we can share of what we did in Malaysia as well. And we also look forward for other participants from different continents. We would like to share all this our network in terms of OH and OSH practice based on our countries. And last but not least is about joining the ACO. Please bring your loved ones. You can register it under the accompany person, roughly 150 ringgit. So translate to US dollars is about 30 to 40 US dollars. And the accompany person can join the conference. And then the second part is about the discounted price for you to use the Malaysia Airlines or Firefly. So Malaysia Airlines have agreed to sponsor and to subsidize in terms of the air tickets. And please use the promotional code for you to get entitled for that discount. And for those interested in scientific papers, all your submission will be published in Annals of Occupational and Environmental Medicine, AOEM. You still can send it to our secretariat. Please do contact the secretariat if you're interested to submit your scientific papers. And we would give a good, attractive prize in terms of best paper and best oral presentation. And we hope it can be an exemplary for everyone to see how the presentations looks like. And last but not least is to show the world that you are attending. So we'll send you the template of I'm attending ACO to your email, and you can change the pictures and put it in your social medias to tell everyone that you are coming to ACO. And we as a secretariat from Malaysia really look forward to welcome all of you to the ACO and would like to know more about your best practice at your countries. Okay, and last but not least is about to promote our next webinar series, which is the 20th series on genetic polymorphism in occupational medicine medical surveillance. So this is more interesting for those interested in the line of very accurate in diagnosing, accurate in monitoring the medical surveillance. So I believe we'll be listening to Dr. Adi Mutiara from Indonesia to talk about this genetic polymorphism in occupational medicine medical surveillance. So it is going to be conducted in 1st of July next month, around the same time, 2 p.m. Malaysia times. So let's meet up together and have this good webinar series on next month. Okay, and next is about the points that we have promised earlier on for the Malaysian participant. For this webinar, you can claim your CPD points from the MMAs and scan this QR code, and you can entitle certain points by joining this webinar today. Okay, so I am sorry because I just received few question added on to this session, but we have to close in view of and in respect to the time that allocated to us. So I think that's all from me. I'm Dr. Fikri from Malaysia. Would like to see you in ACO in August. So have a nice day, everyone. And that's all for today. Thank you. Assalamualaikum and good afternoon. Yep.